Welcome to the Rhode Island Division of Developmental Disabilities Quarterly Community Forum. Tuesday, March 18, 2025. Hosted by Advocates in Action Rhode Island. This is the raw footage from the June forum. Please visit us again soon to view the edited recording and additional resources.
Welcome, everybody.
Welcome.
Welcome.
Hi. Do me, Miss out. Miss out.
Yes, Zach.
Hi, everybody.
I guess want to say, happy birthday, Hannah. And I guess want to say, are we going to be having maybe some kind of RAFFLE raffle size PRIZES?
But you mean from the leadership in the Graduate Academy, now that you mention it?
Yes, for my 25 AMAZON, so I can do some online SHOPPING. Or being the Amazon gift card for me this Saturday when Terry T me out to Tigers, and I can buy myself Bay Rock Boston South to Canada for 2026. And I have a Bay Rock Boston South book.
Zach, we can't do the raffle here because not everybody who's here is part of all that. So maybe at the next Academy of Connections, you can
But when are we going to attend the next leadership? Can you let me know so I can?
Yes, we'll let you know, Zach.
In my Canada.
Yeah, we'll let you know.
Goon, if today is how about June 15? Because
the 15th
I will be on vacation June 29 for camp.
Zach, you might not even win, buddy.
Yeah. Camp Jabberwocky's coming up. Jabberwocky, yeah.
Can we do it before I go?
We'll see, but for now, everybody's going to mute because we're going to get this meeting started. Okay, Zach?
Okay. Tell me
we have a lot to go over today.
Tell me when I can unmute and talk to Kevin about SLA because
I sent the email, Zach. I sent you that. I did it already. Remember, we just in the last meeting we said we're going to send the email stuff. Yeah.
I won't have to talk to Kevin.
No, look in your email. I sent it to you and to Joanne.
Okay. Yeah. But if I.
Okay. All right, we're muting.
All right, here we go.
Hello, everyone.
Kelly. Yeah.
Hello.
Hello, everyone.
Hi, Kelly.
Hi, Kelly.
Welcome to the Quarterly Division of Developmental Disabilities Community Forum. Thank you graciously for coming. My name is Kelly Donovan of Advocates in Action, and we are going to have some announcements from Andrew Whalen. Take it away, Andrew.
Hello, I think there's supposed to be some slides on the screen, and I'm supposed to read from. Here are some Zoom tips to get us started. Tip 1. Stay on mute. Unmute to ask questions. Don't talk when somebody else is talking. That's considered rude and bad form. Tip 2. It's your choice to turn your video on or off. It may help Wi-Fi to keep your video off. Tip number 3. Not everyone can use the chat, so try not to use the chat. In fact, I think we'd prefer that nobody uses the chat at all, because not everyone can read, obviously. Tip number 4. Turn closed captioning on to read what is being said on the screen. ASL interpretation will be with the recording.
Andrew, can you just describe that picture for the closed caption of how people can turn it on?
Yeah, it's going to depend on what you're using, what operating system you use. But in general, you're going to look for something with CC in a box, and it's going to have the word captions next to it, whether it's under the More icon on your Zoom or whether it's by itself in the same general area as the More icon. Thank you.
So if if anybody needs help turning on captions, if you want captions, just go woo 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 woo, and we'll help you turn them on. But you have to do the woo woo woo. Okay. Oh, okay. Ready for the slides then? Who's
Yes.
okay?
There's a couple more. Yeah.
Here is the agenda. First is a message from the Director of the Division of Developmental Disabilities. Second is a division update from conflict-free case management. Third is division updates on employment. Fourth is an announcement about the Advocates in Action online watch party for our film, Lad's Best Judgment Lad School Lessons. Fifth are updates from the Rhode Island Statewide Workforce Initiative. Sixth is a tutorial from Ripen on their new Link with Your Community guidebook. And finally, at number 7 is our community check-in. It gives you a chance to ask questions and get some answers to whatever issues you might be having. And now for an announcement from the Division of Developmental Disabilities. Here is the director, Kevin Savage.
Thank you, Andrew. I appreciate the introduction and for you setting us up to have a successful meeting today. So my name is Kevin Savage. I'm the Director of the Division of Developmental Disabilities at BHDDH. On camera, I am wearing glasses, a tie, and a green sweater. If you're trying to picture me right now. What I'm going to talk about first is a bit of a message on the work groups that we've been working on. We brought together people in 4 team-led work groups to share ideas and to create guidance for the community. These groups made helpful tools that are now being finalized and improved. The groups work to develop guidance about conflict-free case management. You'll learn about conflict-free case management from a flyer and guidebook in more detail soon. We also had a person-centered planning, like PCP Review Kubrick, to help train people who write and plan to ensure quality and flexible and broad goals. We talked about goods and services, like the goods and services spreadsheet that stores feedback, questions, and action items the group came up with. This helped the group to stay organized and plan what they will do next to help make goods and services information better. And we worked on how providers can support people who are aging. Some of the groups are still meeting to continue their work. Once the guidance materials are complete, we'll share them in our newsletter, which you can sign up for free. The guidance about conflict-free case management and independent facilitation, that's one of the names of the work groups I'm naming now, so that's one of the work groups. The second is individual support plan guidance, also called person-centered plan. The purpose of that group is to assist people in writing quality ISPs, now called PCPs, or as I said earlier, person-centered plans, that adhere to Medicaid rules, but allow maximum flexible use of individual budgets so that minimal changes can be made as needed. Also, the third group is guidance about goods and services, and the purpose of that is more flexible guidance regarding goods and services and to clarify how the purchase order process occurs. There's also guidance about adults with intellectual or developmental disabilities who are aging. The purpose is for guidance regarding individuals who are aging including components of quality lives and how to bill for individuals who elect to stay home for part of their day, and ensuring people know this information. It's not only that the information happens, but we make sure that you're able to have knowledge of it so that you can access it as you need it. I'm going to turn over to Joanna to talk a little bit about conflict-free case management. Johanna?
Hello, everyone. My name is Johanna, but you can call me Jo. I work with the division and I'm on the communications team. And part of what Kevin was talking about is one of the work groups was conflict-free case management. And out of all of that, we worked with a group of wonderful people that asked for this wonderful document that you see here. It's an overview. And you're going to go through the steps, and it's what happens when you start conflict-free case management. I know this is an important topic for a lot of us. It can feel overwhelming, but it's super exciting. And you'll get to know step one is what you do when you get contacted. You're introduced to your new conflict-free case manager or your independent facilitator. This document in itself has a word key on the top left so that, I don't know about anyone else, but the letters, the acronyms, all of them, they get so confusing. And so I love word keys because they help me get and understand all of that stuff straight. The second step after you are introduced with your conflict-free case manager is to getting ready and prepared to meet with them or your independent facilitator. And so we created a guidebook, and this is an overview to help you understand of what kind of questions you should be thinking about, what kind of questions you have, and to have them ready for your first meeting with them. The third step is to be curious about what you want to do and things that you want to try. Tell your conflict-free case manager about yourself so that it can get to know you, what your strengths are, what you're comfortable with, what you don't like, what you do like. Step 4 would be about exploring your life in your community with the supports with your conflict-free case manager. Remember that they're here to help you choose the cool stuff that you want to do with your life. Number 5 would be to think about who you'd like to help you work towards your goals. Your conflict-free case manager can help you get started by connecting you with services and supports to help you on your way to the best choosing of the best services and the things that you want to do. And lastly, you get to check in. You have someone that you get to talk to constantly and check in with often to report any problems, to see how it's going. I really love this. I really don't like this. And whatever that looks like, if you have any problems with your conflict-free case manager, in general, you could always ask to speak to a division supervisor, and we provide you the information there. So there's always choice when it comes to conflict-free case management. And this is an overview. So it's supposed to be helpful. Hopefully you find it helpful, and we'd love to hear feedback after you see this. So if you think we need to change some stuff, we'll be more than happy to be flexible with that as well. The next slide, please. So like we talked about earlier, that first page is an overview of this, is the conflict-free case management guidebook. This is what it looks like on our website. When you get this at the end of this forum, you'll get a copy of this presentation, and you also got copies of this link, I think it was yesterday, from Advocates in Action as a gentle reminder of all the resources that are going to be shared with you today. So don't feel like you have to remember where this is. We gave you the links to the web page. So there's also other resources on that page. Also, you'll also have the link to the conflict-free case management guidebook itself. So then that way you'll get to walk you through those steps as well of what to expect on this new exciting adventure with the division. And that's all I have for conflict-free case management. Up next, I believe we have Mr. Jay McKay for Employment Services.
Good afternoon, everyone. My name is Jay McKay. I am the Associate Administrative Support Employment Services here at TD. For a visual, I am an older white male with very short brown and gray hair. My background is my office wall with a window. I'm going to give a very brief, because I know we've got a lot on the agenda today, update as to what we've been up to with the sort of support employment team. We met with all the support employment providers recently, that's about 30 plus, to talk about growing employment supports. We received good feedback, some not so good feedback, which is all great. We talked about new jobs, goals, trainings. The good news is that the employment add-on budget has had a positive impact. And the other good news is that we're on target to meet the consent decree goals of 175 people getting jobs. We are very grateful to the providers. They've been doing a great job. And what this means for you is that if you're interested in working, you can visit our employment webpage to learn more about your options, or you can also talk to your case manager to get started. Additionally, I will also put my contact information if you should have some questions for me about employment. We're here to help, and I'll make sure that you're successful in your path to employment. That's all I have. Thank you.
So were there any questions and comments on that first section of information? On either the work groups, conflict-free case management, or employment?
I don't know. I'm just taking this in.
Okay, that's good.
Hi, Kev.
Go ahead, Zach, you can go.
I'm asking me. I have a cousin. So say that if I were to get a job, but I already have a job, and I want you to listen that. I want you to listen to the whole story. So say if I well, but I already have a job. I would like to. I would like the thing that you said about the like. Okay, Dad, can you help me out? Like the thing that she said about the case sent to Pammy.
Conflict-free case manager.
Yeah, I would like to, Kevin. I would like to sign up for the conflict case manager because I know that my case manager right now is kind of numbery, but I would like a second case manager, and I would like to sign up for that and have you send me a guidebook in the mail.
Okay, so you want a guidebook?
Yes.
Can someone help Zach with where the guidebooks are? I think we can send it to him by email. And so maybe we'll get that information from you offline.
And Kevin, could you also write down my address because I live at West Trinity. Like I was saying to Deb, she sent me the SLA email to go, and I live in a group home. But
you want me to send it to your group home address?
But my address is
Wait, Zach, you don't want to say
your address.
Don't say it here.
Address.
We can send it to him. You gave it to me in the last meeting. I can just
we'll send it to your address. No worries about that. Physical address.
And
we'll do that.
Kevin, I would like to sign up right now for the conflict case management thing because I don't know what the heck it's about.
Okay. So we can work with you on that.
And can you talk more about the conflict case management team? Like having, will I be having a second case manager, and will they come out and talk to me about what is me to be case conflict thing?
Because so you don't get two case managers. You lose one and get another one.
Okay.
So it's only one at a time, but I can look at Heather and she can maybe just explain how the program works for you.
Okay, can I talk to Heather?
Sure. She's right here and she can't wait to talk.
Heather, can you come on?
I am. I'm right here.
Okay.
I am on screen.
Heather, I want to ask you. So okay. So how would excuse me? How would like I'm more interested in signing up for the whatever the conflict case management system, but how if I were to do it, how would I use a case manager and get another like Gohana or you or Kevin or Gay or myself or whoever, because I really like kind of number B, but I don't want to hurt her feeling and get rid of him and have him go and work with somebody else. But how would I really want to do it, because now I went to bed, and now that I was taken to rest to the hospital this morning.
Okay.
And
You know
I
what?
did
Zach,
not-
Zach, we
Yeah.
just had a,
Let me
can I just say,
let
we
me-
just had a
yep.
community, we just had a meeting before this and we got the whole story. And we talked about that you don't have to do it again here because there's a lot of people here, but Heather
Okay.
can email you or call you after the meeting.
Can I have her call me? Can I have her my email and my
I can
phone
send it to her
number?
because we have it.
Okay.
I just sent you one to that other person. I'll do the same thing for Heather, okay?
Okay, thank you.
Because there's
You
a lot
need
of people here.
information, and
You
Zach,
are a
I will
good-
follow up with you. I will
Okay.
follow up with
And
you
can you
to
come
give
out?
you information about conflict-free case
Okay, and
management.
can you come out to the house 105
Don't tell me where you live yet, Zach. We don't want to give personal information here because there's a lot of people. So we have your information, and I will make sure that we get in touch with you and connect with you. I hear that you want a case manager. I do hear that, okay?
And we can get someone to come out to the house. It won't be
Yes.
Heather, but somebody will come out to the house and meet with you. Okay, any other questions? And we want to hear from you. We're here to hear from you. And so Zach had a question. We're going to get someone to meet with him. So it made a difference that he asked. I want people to remember that. Anybody else? Okay, we'll
Hi,
move on.
this is, oh,
Sure.
sorry. Hi,
That's
my name
okay.
is Olivia.
Hi, Olivia.
Hi. I don't have my camera on because I just got back from work and I don't look my best. So I'm gonna keep my
Okay.
camera off.
That's fine.
So, jumping with, or along with what Zach had said about the conflict-free case managers, do they change? So I'm newer here. Do you know if do they change monthly, or is it the same? Is it the same person?
It's the same person.
Okay, thank you.
Yeah, you're welcome.
But they connect with you monthly, right?
Yes, they
We've been
connect
talking a
monthly, but
lot
it's the
about
same.
this in a lot of different places. So some of the
Yeah,
information,
that's
yeah.
great. Thank you for doing that. Keeping people informed. We appreciate it. But yeah, the same person should be calling you monthly. You know, of course, people, you know how that works in our system. People come and go. So if they quit and we need to hire someone new, it will be a new person. But if they stay as a conflict-free case manager, it will be the same person who contacts you monthly.
Yes.
So thank you. Anyone else?
How do I know when I'm getting switched over? Does it just happen, or?
You
Well,
would get,
yeah, it seems like it just happens, but it's not as miraculously as you think. There is groupings of people and how we kind of transfer them over. And so our goal, of course, is to get everybody transferred over as quickly as we can. But some of the factors involved with how we can transfer people is the availability of conflict-free case managers in our system. And then we transferred different groups of people at different times, and that's how we're working on it. I won't go into the details here, but our goal is to get as many people transferred as quickly as possible. So if you want to reach out to Brenda and ask her, I can have Brenda reach out to you on where you are on the list. We can certainly do that if you want to know. Does that help, Kathy?
Yeah.
All right, I'll have Brenda call you.
Can I send a message to you with the phone number?
Sure. I think we have your phone number.
It's gonna be different.
Okay, then send us a message. Yeah.
One thing, I don't remember if you said that specifically when you were talking, but one thing that we've been telling people, which is a good message also, is that this is you talk to your conflict-free case manager when you used to talk to your state DD worker. Now you would talk to that person. And the thing that's nice is they have a much smaller caseload because meeting before that,
Yeah.
people were saying, people have gotten left on hold or messages and this
Yeah.
is much more, more access. So.
Yeah, exactly.
To me, Kevin, could I have one more question and then other people can talk?
Is it about those slides though, Zach?
No,
it's about those
it's something.
topics?
No, it's something different. It's about the case manager. But if I were to meet with them at the house in private, and they talk to me, how will I lose a case manager and get another one?
You would, so hi, Zach, this is Heather again. If you are working with a case manager that you feel like it's just not a good match for you, then you can ask for another case manager. And so
And if the person you have right now, because you said you don't want to hurt their feelings, but if they work for your agency, they can't be your case manager anymore. Again, it's not the state that's saying it, it's the federal government that they can't do it anymore. So you need to have a different person. Are you still talking, Zach? Because you're on mute. But you said you only had one more question. So we're gonna go on to other people. Is that all right? Do you want the slides back up? Are you trying to say another question, Zach, or are you just
Fast, like overnight, is someone gonna come out like what is today?
Can I just answer because we just had a meeting, Zach?
Yeah.
I'm just going to answer again that they're not coming tonight. They will be in touch. But remember, we said even for the other person, it can't happen instantly. And I know you're have some strong concerns about wanting to change things up. They'll be in touch with you as soon as possible. Okay.
Okay.
Yeah, because they're on top of this too. They get it. It's time for some. Yeah.
Now we can move on.
Okay.
Okay. Thanks, Zach.
No problem, Kevin. Kevin, do you prefer to be called Kev or Kevin?
Your choice. Either is fine.
Mr. Savage.
How about Kev? How about Kev?
Kev is fine.
I prefer you to be my new case manager.
No, that's not fine.
How come?
We have
he
case
works for the
managers that can't
state.
do their jobs. We violate our union contract.
How about Gay McKay?
Zach.
Jay is not a case manager either.
Yeah, they're gonna tell you more about it.
How
But
about
the people, they're whole new separate organizations that are just for this.
I knew Zach was going there when he was asking for our names before. I
How
knew
about
it can't be one of us.
How about
all right, we're gonna move on.
How about Hannah?
Yeah, no
It
Heather
can't
either.
be me either.
How come?
You don't want me as a case manager.
No, but seriously, Zach, okay? Because I mean, I know and I love you, but you gotta move on. You gotta share the time, okay? Okay.
Thank you, Zach. Okay. Any other questions?
I'm sorry. No.
Okay. I think next we have up Advocates in Action. And they're going to share. I'll let them say what they're going to share on.
All right. We here at Advocates in Action are going to share an announcement about our film, Best Judgment Lab School Lessons. Next slide, please. Please join us for an online watch party as Rhode Island PBS airs the final cut version of this important documentary. That is Best Judgment Lab School Lessons. It is Thursday, July 17th. Come into the meeting at 7:30 to meet the film crew, and then at 8 o'clock we will watch the film, and that's in the evening.
Andrew. So if you want to register for that, it's actually going to be set up like a webinar. So it's really just a watch party. You can go to www.tinyurl.com/ladfilm. And that's how you can get the Zoom link to join us. We are going to have raffle drawings to give away Best Judgment Lad School Lesson t-shirts. So that's fun. So when you register, you'll see a place to put your address, your mailing address, and also your shirt size. So if you win, we can send you the shirt that you want. But this is going to be really cool because we're all going to watch it together online while PBS is airing the film. But the film is going to have a little bit of a different look than maybe what you've seen before because we did some final editing with color, and with Andrew Whalen did some voiceovers for some of the parts of the film that didn't have sound but just had words on the screen. So there are a few different little tweaks that were done to it. Now this is it. This is the final cut version is what they call it. So that's what's going to be airing on PBS on July 17th at 8 o'clock. And if you want to join us for the watch party, start at 7:30 on Zoom, and you'll get to hear from the film crew. That's it. Thank you.
This
Thank
is the
you.
version that's going to win us the Oscar, this version.
Yes. No joke. I believe it.
Okay, should I go ahead and get started?
I was going to say, okay, Kim is next, so thank you, Kim.
Yeah,
And
of course.
yes, please.
Thank you. Good afternoon, everybody. My name is Kim Einloth, and I work for the Paul V. Sherlock Center on Disabilities. I'm a mixed race woman who is wearing glasses and has dark curly hair and wearing a dark blue sweater. I have a light blue black background with the Sherlock Center's logo on it. The Rhode Island Statewide Workforce Initiative, otherwise known as RISWI, has one main goal, and that goal is to make it easier for provider agencies and people who use self-directed services to find and keep great direct support professionals, DSPs. The DSPs provide quality support for adults with intellectual and developmental disabilities. RISWI was created to help improve support for Rhode Islanders with IDD by addressing DSP shortages, that's direct support professional shortages, and that direct support professionals don't always have access to the training they need to do a great job. RISWI has several work groups to help with this work. The work groups are open to anyone who wants to improve the direct support workforce in Rhode Island. Today, I'll share updates on the progress that we're making. So as far as workforce achievements goes, since 2022, DSP direct support professional pay has gone up. And those are the DSPs who work for provider agencies. On average, these DSPs are making just under $22 per hour. More people are getting support because there are more staff, and less direct support professionals are leaving their jobs and staying longer. So these are all really positive trends since 2022. People who use self-directed services are invited to take part in 2 new projects this summer. The first project is a self-direction staffing survey pilot. The survey is offered in English and in Spanish and is open until June 27th. The survey link was emailed to people who are on listservs through email. The Sherlock Center, Ripon, Lazo, Best Life, and the Rhode Island Self-Direct Coalition have all shared the link with people who self-direct their services and are on those listservs. The survey asks basic questions about your staff. So for example, it asks how many staff you have. if any staff are family members, if you need more staff, if any staff have left their job, how much you pay your staff. So those are some examples of the questions. If you or someone you know self-directs their services, please respond to the survey. Please encourage your friends to respond to the survey. We have a goal of collecting 300 responses, and your experience matters. So the survey gives you an opportunity, a chance to share what's working and what's not working. By joining, you will help shape the solutions. By joining, you're helping to improve staffing supports for people who self-direct. That input is being used to guide future programs and to improve staffing supports for people who self-direct. Kathy, I see your hand up, but I have 2 more slides and then I'm happy to take your question. Next slide, please. So I said that there are 2 projects. The survey is the first one. The second project is this self-direction virtual learning series pilot. This series will take place in July and August, and it's for people who use self-directed services and to help them build better staffing skills. Up to 10 people who participate in the staffing survey will be invited to join in this learning series pilot. The series includes a group session to share ideas, one-to-one meetings to create a plan, your choice of up to 3 learning sessions about hiring and keeping great staff, and a final in-person session and resource fair at the Sherlock Center. Please email riswi@umn.edu to join. And then we have our last slide before I can take questions. And that is, I invite you, if you'd like to learn more about, next slide, please. Thank you. If you'd like to learn more about the RISWI, please email us at riswi@ric.edu or visit the Direct Support Workforce webpage at www.riswi.org. I don't know if I said that correctly. I'm going to repeat it. www.riswi.org. It's a place where you can go for resources that will help you hire, train, and retain, keep those great DSPs. For example, there's a realistic job preview video available to any employer, for any employer to use to show potential DSPs the reality of the job. These resources are a result of the RISWI workforce work group work. That was a mouthful. So that's my presentation on the statewide workforce initiative. I welcome questions and comments at this time. I think, Kathy, you're first.
I may have missed it, but I don't remember seeing an email.
Okay, Kathy, I will. Are you on one of the listservs for Sherlock's self-direct supports network or on Ripen's distribution?
I don't know.
Okay, I will make sure that you get a link.
We're gonna put it. It'll be up there with the recording also, on the page for all of this stuff too. Any of the stuff you hear mentioned here is going to be up there too, so you don't have to worry about taking notes about it.
Yes, thank you, Deb, for that reminder. And honestly, Kathy, if the email address that I had mentioned that's going to be available to you afterward, you can email the riswi@umn.edu, and they can provide you with the link. And I can put that in the chat if it's helpful. And like Deb said, you can get that information shortly.
Thank you.
Thanks, Kathy. Any other questions or comments about the statewide workforce initiative?
Yes, Kim, this is Andrew Whalen. About the survey you mentioned, how does one, or where does one go to find it?
Yeah, so there's a survey link that should have been emailed to you and anyone else that uses self-directed survey services. Those email links are coming from Ripon, Sherlock, Best Life, a variety of key contributors that are helping us distribute the survey link. I'm going to put in the chat momentarily an email where you can request that link if you haven't received it yet or would like to get access to that link.
Yeah, not everybody, this is Tanya Blicker, Ukraine. Not everybody's on that those whatever, those lists. Sorry.
Okay. Thank you, Tanya.
Just saying.
Yes, I appreciate that. Thank you so
Yeah.
much, Tanya. I'm gonna, when I'm done talking, I will type that into the chat, the email address. You can let them know that you would like a link to the survey and they will provide it for you. Thank you. I'm glad to hear there's so much interest. And Sue, I see your hand up. So thank you. I appreciate your interest in taking this survey. We have several people who have already taken it. It takes about 10 to 15 minutes to complete. So we really appreciate everybody's participation. It will really benefit the community. And then you'll have the opportunity to join the learning series if you'd like. Sue Donovan, did you have a question or comment?
I do, Kim. Kim, is the survey anonymous?
That's a great question, Susan. Is there somebody here from the University of Minnesota that can respond to that question?
And what anonymous means?
I believe my colleague Sandy Pettingill is here.
Sure, I can hop on and answer. Yes, you do not have to provide your name as you go through and take the survey. However, at the end, there's a section that lists an optional opportunity if you would like to participate in the learning series. And if you provide your name and your contact information there, we can enroll you in that. So otherwise, you don't have to put your name on there. And just so you know, also, that's not, the data is something that's private. It's something that only actually I am looking at. And so it is protected in that way as well.
Thank you, Sandy. Great question, Sue. Any other, these are all great questions. Any other questions about the survey, the learning series, anything about the statewide initiative?
Yes, I actually do have a weird question. I know, Kim, that we have talked like many times about things in my team here. Like not now, but way in the future, how can we help you, or how can we collaborate?
That's a great question, Anna. Thank you for asking it. We welcome all the help and support we can get to move this initiative forward. You and I have talked a fair bit about the different work groups, and I would love to get together and discuss that with you again. And in the meantime, when I'm done answering questions, I can then put in the email address where you can contact me, and this goes for anybody. You can contact me if you're interested in joining this initiative and being a part of it and supporting us in continuing the work in the right direction. So I will share that in the chat also. Great question. Thanks, Anna. I really appreciate it. Any other questions before we move on?
Zach has been raising his hand. It's about this though, right, Zach? Yeah, I know you. Zach and I have known each other a while. Go ahead, Zach.
Kim, I want to talk to Kim and not you. Kim.
Yes, Zach.
I am a 43 going on 45 young old adult, not pushing it, but I do not work for the wonderful Paulson Center. But if I would love to work for them, and I am dying to sign up, how can I sign up, and what the heck does Paulson Center mean, and why do what you got to do?
Wow. Excellent questions. Let me see if I can remember them, and I'll do my best.
Okay.
So
And before you, could I take the thing on Zoom that my party and then enter to win a free t-shirt because I need plenty more t-shirts. I have like a couple, but I need plenty more.
The t-shirts for the best judgment, the stuff that you have to come to the premiere and there'll be a raffle.
Could I do the premiere on Zoom?
It is on Zoom.
Okay.
Yep.
And could you
So the questions, because we don't want to run out of time, okay? So she's gonna answer, but the questions should be about what they're talking about.
Okay.
Okay?
Kim.
You asked them, she's gonna answer them now.
Okay.
Yeah, Zach, thank you. So the Paul V. Sherlock Center helps people get connected to their communities, to work and school. We are pushing for full inclusion, and we believe in membership for all. So that's what we do at the Sherlock Center. One of the projects that we're involved in is to strengthen the direct support workforce. And so that's what I just provided an update on. And we always welcome anyone who wants to participate in the initiative. There's lots of different work groups that you can join, and we have different aspects of the work that you can participate in. So I will put something in the chat. And as Deb mentioned, you will also receive something after this meeting that will summarize all of the information and give you email addresses where you can reach myself or Sandy or other members of the initiative. I hope I answered all of your questions.
We move on. What are some of the workforce activity or different group that you said that I'm anxious, I have a lot of anxiety, I'm dying to participate in?
Okay, so Zach, I'd be happy, because we know each other, I would be happy to set up a time to meet and discuss further. And whether I know you or not, happy to do that with anyone. But I can go through all the different work groups, Zach, where we focus on training and data and recruitment and selection and the worker voice. So we have several groups, and I can go through each one of those with you so you can find the right fit. Any other questions? Or I know we're tight on time, so I know we need to move on. Are there any other questions or comments, or are we ready to move on? Thank you, everybody.
Thanks, Kim. Okay, and then now Sue Donovan from Ripon.
Hi, everyone. Thanks for coming today. My name is Sue Donovan. I am a white woman. I am an adult white woman. I have a yellow print dress on, and my background is dark green with white letters that say Ripon and a white logo, which is a compass, which helps us find direction. So next screen. So I'm happy to share that our recorded webinars are on our website. So please check out the Ripon website. We've recently added the latest panel presentation called Navigating Mental Health Services. It was very well received, and so check that out on our website with the recording along with some resources that were shared that evening. Next slide. Next week, we're getting together in person. We're going to the Impossible Dream for a little scoop, snack, and chat on June 26th from 4 to 6:30 p.m. Please register. We are taking registrations, and the registration link will go out with this presentation, and you can also register on the Ripon website. Next slide. Back by popular demand. On August 26th at 6 p.m., we will have a live webinar. It's our 2025 version of Employment Supports for Individuals that Self-Direct. Several folks that are here today will be joining us that evening so that we can have what's latest and greatest on what's available for employment supports. Next slide. The self-directed support toolkit is also available online. That link is here and will be going out with the presentations. In that toolkit, you can find templates and documents that can help you with tracking or keeping information, sharing information, and just helping making your self-direct journey a little bit easier. Next slide.
Can you just read the link for people that don't see it?
Okay, sure. That's RIPIN, RIPIN.org, O-R-G, / self-directed toolkit, SELFDIRECTEDTOOLKIT. And now I'd like to pass it on over the mic over to my friends Sharon and Lynn, and they're going to share the community guide with you. Thank you.
Good afternoon, everybody. Thank you for joining us. My name is Sharon Koshin. I'm the manager of the Self-Directed Support Program here at Ripon. I am a white woman with a blue top and a white sweater with short brown hair. And my background is also green with the white letters of Ripon logo and the compass. And I'm going to just have Lynn introduce herself and then we'll get started.
Everybody, I'm Lynn. I'm from the PTIC, which is the Parent Training Information Center at Ripon. I'm a white woman with long blonde grayish hair with a green background and the Ripon logo with the compass.
Thank you. Next slide, please. So what is the community guide? Originally, it was supposed to be used as a resource for students that were in the transition process of entering adult services so that they could become more engaged in their community before they left school. But as we created the guide and added lots and lots of resources to it, we realized that really this guide is for everybody. It's a way to find meaningful and fun activities that can fill your days and meet new people and ways to reach your goals. It is an interactive guide as well, and we're going to show that in just a minute. Next slide. So why was it made? Again, it was because we had a lot of, it can be difficult sometimes to find things that you want to do or to meet new people and get some new experiences. And this way, using this guide, we can connect to local events. You can connect to social experiences, recreational activities. There's ideas in there for volunteering in your community and other ways to tips and tricks to help you engage in things that are in your community and all through Rhode Island. So this is where you get the guide. There's a QR code on your screen, or you can go to our Ripon website and download the link from the guide from there. The link would be Ripon, RIPIN.org / link with your community guide, LINKWITHCOMMUNITYGUIDE. And we will make sure that this is in the resources after this presentation so that you're able to access. One of the cool things about the guide is it gives you a table of contents and it's broken down into some different areas for you to explore. One is a how-to information about accessibility and transportation. We've got a page all about the libraries in Rhode Island because we know some of our friends really love to visit the libraries and do fun things there. There's a museum page about all the different museums that you can visit in Rhode Island. There's an Explore My Interests, which is, if you want to join a sports team, if you're looking for new bike paths or new walking trails, there's interests. And then there's also community-based links that you can find out what's going on in your city or town. And don't get lost because there's like I said, the guide is interactive. So you're able to use back buttons, go back to the menu, go back to a map, and it really is friendly to use on your smartphone. You can download it to your tablet or your computer, and you can take it with you. And I'm going to give it to Lynn, and she's just going to highlight a couple of our favorite pages. Lynn?
So this is our events page. So the events page is going to tell you about things that are happening. It could be ongoing events that might be happening in your community, or maybe seasonal events like summer concerts in the park, things like that. And sometimes they're one-time events, but it's helpful for your DSP, which is your direct service provider, to be able to find some interesting things to do together that are meaningful for you in the community. So looking to see what's happening is really a great way to stay involved in your community. Next slide. So accessibility, and when we talk about accessibility, we often just think about mobility and barriers such as wheelchair accessible, but this also highlights some of our places that are also sensory friendly for some of our folks that may need low volume or certain lighting. So this just highlights some of the activities that you might find in your community that are accessible, but there are a lot more throughout the state that do have accessibility. But it's always good to research that before you venture out, especially if you do have some barriers, whether they be physical or sensory or visual or hearing impaired. Some places might offer some auditory supports when you go to a theater, perhaps. Okay, so always research that before you go. Next slide. Transportation. This is always a big issue in our community, right? How are we going to get there? So this page here talks about all the different ways that we can get around our state and get to different events, whether it be taking the RIPTA bus. Some people might want to get out there on their bikes. This, if you look on this section here with the bike paths, it really does a great job at highlighting some of the bike paths throughout the state and some of those paths that are also shared with our roadways as well, as to get to different places. And different ways to get around using the train and the plane. Next slide, please.
So I'll take this one. Yeah, we know that Rhode Island is very diverse, and we like to highlight all of our cultures and explore and learn new foods and learn new dances. So this page can help you find local festivals and Latina outings to celebrate all that Rhode Island has to offer. Next slide. So we wanted to show you some pictures of the guide in action. This young man is PJ. He is in the transition program at one of the area schools now, and he is exploring the beach at South Shore Beach in Little Compton. And then the other picture is when we stumbled upon the great elephant migration over in Newport. And if you look at all the way to the right, you will see that it says, where can I go in my community? And it's broken down by county, and it's broken down by each individual city and town, so you can find out what's going on in your area. Lynn?
So this is Marina. She's my 26-year-old daughter who utilizes self-direction. And these are some of the ways that she has used the guide. One of her goals in her ISP is to be physically active and get some exercise. We found these wonderful Rhode Island walk trails. Movement is not always her favorite thing. So motivating her is always a challenge. So finding these little creatures where they scan a QR code and then they can track how many creatures they find was very motivational and very exciting for her when she found that creature on the path. Something we did not know about, I don't know if everybody else knows, that Rhode Island has a pinball museum. So in the museum section, we found this pinball museum, which doesn't just have pinball machines. It has all kinds of kind of nostalgic games, some skee ball and basketball. The only thing Marina did say about it is the place smells old. So some people with some sensory issues may not want to go there, but it was a lot of fun. And again, physical fitness is one of her goals in her ISP. So finding different places, we go to a couple of different yoga places, and Shri is very welcoming, and she attends Shri pretty much regularly for yoga. Next slide, please. So again, exploring interest. You can see PJ and his brother Zach are out there living their best lives, exploring places of their interest with camping, PPAC, and they went to, was it Jason Mraz, which is also, I think, supported by the Autism Project, which was a sensory-friendly show. So that was a great opportunity for them to explore their interests and do things that they like together. Next slide. Something else that Marina was pretty excited to find out about. So the library, like we said, is a great place for a lot of our friends, but this is something we did not know, that the library now has room of things where you can take out things. And Marina chose to take out a metal detector. And again, physical activity in disguise. So now she's out walking the beach. She is hunting for treasure. She's digging for treasure. Did not find anything, found a few screws, but she had a great time with her DSP out there exploring and visiting her local library to take out fun things. She also took out a cornhole game. If you haven't checked that out in the libraries, I definitely recommend it. Like I said, it's not just for books anymore. Okay, and next slide. Thank you. This is, a great way to meet up with friends and explore your community, finding activities to do together, and, share that with your friends and make new friends in your community by doing some of these activities.
Yep, we encourage people to use their interests and see what's out there as far as getting together with others that share your interests. Next slide. So we want to hear how excited you are now to explore your community. If you could use the react button at the bottom of your screen, it's a little heart, and then give us a thumbs up, a heart, clapping hands. We'd love to hear back from you and answer any questions that you have today. I'm seeing clapping hands. I'm seeing hearts. I'm seeing thumbs up. I know there's some comments in the chat, so I'm just going to go back real quick. Thank you, Jay. Bravo. This is awesome. From Susan Hayward, our Youth and Transition Administrator. She said the guidebook is an absolutely fantastic way to find things to do. Our friend Kelly says, I love smelling old things. And Sue Hayward again says, who knew that other than books and movies at the library, you could borrow something? What's wonderful information. Does anyone have any questions for us?
Yes,
do you want that last slide up or no?
Yes.
The link with, okay, sorry,
Yeah,
Ann,
yeah.
I just turned it off because of the questions. So
that's okay.
All right.
Yeah, thinking back, I probably should have put this slide up before the emojis next time. So where will you go today? We want to hear from you about your adventures. Snap a picture and send it to us. We're always going to be making updates to this guide and keep it fresh. So please use the email linkwithus@ripen.org. That's LINKWITHUS @ripen, RIPIN.org. Thank you. And now we'll take some questions.
This is Stephen. Could you
Yes.
say again where you access the guide? Where do you get it? Is it on the Ripen website?
It is on the Ripen website. You go to the self-directed support page and find it there, or you can go to our resources tab at Ripen, RIPIN.org, and search the box for community, and you can get the guidebook there as well. And we will make sure that the link is available for distribution after this meeting.
Great, thank you.
There's the
You're welcome.
There's a QR
There's a
code
QR
again
code,
too, if
yep.
you want to aim it at it. Anybody, you
Thank
just aim
you.
your camera at it. But this will be on the webpage too. This will all be
Yeah.
there. Anna started to ask something. We cut you off, Anna, because I had to put the slide up.
That's totally fine. I'm working on not disrupting people when they are talking. So that's my big thing. But yes, I actually do have two questions.
Okay.
One of them, if this is possible, to send over like any raping or self-direct upcoming calls.
I'm sorry, I didn't get it's about self-direct upcoming
And
events.
like
Or
upcoming calls when Sue Donovan was talking about the upcoming columns.
So Anna,
columns. I'm sorry.
so next week, so when you go to our website and you go to the self-directed page, it has a schedule of different trainings or in-person events that we're having, and you can sign up to come or to attend a webinar. And I know you've attended some of our webinars in the past, but so next week on Thursday evening, we're going to be at from 4 to 6:30 at Impossible Dream, and we're going to be having some ice cream and some snack and meeting new friends and making new friends. So you can register for that on our website as well. And I see that Laura so kindly put the link into the chat if you want to check it out.
I'm more asking for the webinars.
Sure. Yep. We've got, so the webinars that we did in the past, we recorded all of them and they're on our website as well. So you can go back and check it out if you missed something and you want to check it out. And then the ones that are up and coming, they're on the calendar of events and you can register for those. Anna, do you get our newsletter? Do you get our emails from Ripon?
Not really, no.
Okay, I can make sure that we add you. Okay.
Yeah, sure. Like I just thought of asking about these webinar calls because it could be great to pass it along to my team.
Absolutely.
For
Absolutely.
my
You
team
can
to
learn
do.
so much, and sometimes you can help share things that you know with other people.
Yes. And my final question, and I bet you might go, is of the toolkit that you on the PowerPoint, where do you find or access the toolkit?
So the toolkit you can find, Anna, also on our self-directed page, and we will make sure that Deb and Michelle have the link for it. And it's broken down by sections. So you don't have to take the whole guide and look at it in one time. You can use the pieces of it that you're looking for at the moment. So we can put like schedules, you can look for activities, you can look for questions that when you're interviewing your staff. I believe that Laura just put the link into the chat. I know we're not supposed to use the chat, but we did for those that are here today, and more than happy to make sure that there's follow-up after.
And
Does that
Anna,
answer
if you
your-
have a smartphone, Anna, I just put the QR code again, so you can aim your camera right at that box on the screen.
That's
Deb,
not the toolkit.
That's different. That's
the
for
link.
the community
Oh,
guide. She was
yeah.
looking for the
Never mind.
toolkit. Yep.
Is the link for that
toolkit
in the
one was the
PowerPoint?
hard one to see on that page that you said, oh, can you read the?
Oh, there wasn't a QR code for that one.
No.
Okay, sorry. Now
We
I just
can send it
confused
over
you
to
more.
you though, Deb.
But it'll be on the website. Yeah,
Yes.
I can. Yeah.
Thank you.
You're very welcome, Anna. Thanks for the questions.
You're welcome. I'm just thinking of ways to help and improve my team here in the new department of looking upwards for these things.
Yep. I can see that you're a leader. Anybody else have any questions for us?
Do
Yes, Deb?
do people have to pay for that ice cream social? I know people, that's the question everybody has to, no, okay.
No, they do not.
They just sign up, they have to register though, they
You
can't
get a
just show up
ticket,
and eat,
right?
yeah.
You right. When you check in at the registration table that night, you'll get a ticket, and we have the Pilates ice cream truck pulling up around 5 o'clock. I know Lynn's excited and Marina's excited.
Oh, I have a question.
Yes, Amy.
Do we have to register individually for who's coming? Like, I
Yes.
registered myself, but I'm planning to bring my 2 adult children.
Yep. Yep.
So they,
Each person should have their own registration. Yep. So
Okay.
that we can get a head count for the
yeah,
for the
that's
treats.
what I realized. There
Yep.
wasn't a place to say that we're all coming together on the
Yep.
form. Okay,
All right. Thank you.
thank you.
Any other questions for us?
Another one about the guide, which is a very cool tool. You said it's going to be being updated, so when people download it, like how often do you anticipate, like what would happen with that for knowing that there's a new version? You just going to send out a message to people maybe, or?
So we do plan to update it regularly based on feedback. The one that we just announced it really in April, so I don't anticipate any updates happening like soon. Right, Sue? Do you have any?
Correct.
Yeah.
And the majority of when you access it, it's a web-based guide. So
Yes.
all of those links are going to live places, which is great because it's not
It
like
updates automatically,
it updates
right?
automatically. So it's
Yeah.
you're going into the library system of different towns and cities, and those are getting
Mhm.
updated. So it's which is an easier way to keep it fresh and real.
Mhm. Yeah.
Well, I have a question. When is the Impossible Dream event?
It's happening next Thursday, Michael, June 26th from 4 to 6:30.
Okay.
And just a reminder, because like I just went to the Impossible Dream for like the first time like 2 or 3 years ago. That playground has an indoor venue as well. So there's an indoor area, and then of course there's the big playground area, and there's plenty of free parking. But I like the indoor area because that way I don't get wet, and I like the air conditioning. So I just want to share that.
Yep, the team's gonna have some activities set up for those that are inside and those that are outside. So we hope you can join us. Anybody else? I don't see any other hands, so I'm gonna turn it back over to you. Thank you so much.
Were there any questions on any other parts of the program that you didn't get to ask or you thought of after we moved away from a section? Anything that you came here hoping to hear and you didn't hear today, and you'd like to bring that up? Something we didn't discuss, but you wish we had.
Yes, I've been trying to unmute.
Okay.
I would love to have some kind of an overview and understanding of how LTSS fits in with or can fit in with self-directed supports for individuals with disabilities. Briefly, my kids just turned 22 a couple months ago. They're twins. And for about 15 years, they had 25 hours a week of CNA services who would come and help, a couple times a day to help them get ready and make sure they were clean and, help with their personal care. And with their birthday all of their services went away. We're working with our conflict-free case manager. We've had a couple of transitions of case managers. And so since the end of February, it's been just me. And it's been difficult to even get answers on how it's supposed to work, to figure out where the issue is. And I don't want to like take everyone's time with my question,
Well,
but I would
Amy,
love
thank you
to.
for bringing that up, because first, we're part of LTSS, and our goal is not because of a birthday, you should lose the kind of supports that you need. So it sounds like that's happened, and we have some catching up to do. So I'm just gonna take a note of your name.
Yep. My name's
And
Amy Collins.
Amy
and
Collins, okay.
And it's David Collins and Elissa Collins are the two individuals. Oh,
You're
it's 22.
self-directing, correct?
Yes, we're gonna possibly hybrid self-directing, but we're still working on the plan. I was late getting it going, but
It may just be that because the plan's not complete, that may be the issue, but let me look into it. I'll look into it with Jackie Cameloni, who's our self-directing person, and then we'll get back to you. But
Thank
we'll
you
get back
very
to you
much.
within a week, not tomorrow, but within a week, okay?
Perfect. Thank you.
Thanks so
Appreciate
much
that.
for bringing that up, though. I appreciate
Thank
it.
you.
If you're going through that, other people are too, so that's why it's helpful.
That's what I figured, that
Yeah.
we're probably not the only ones. And I've
Not alone.
realized that part of it is because there's so much change happening at a systems level. But it's been very disorienting for me because
Yeah.
I've been used to for many years being very competent about how to manage
Yeah.
all the different pieces. And I have had trouble like even getting to the place that I could say, ask neighborhood my question, even if I'm not sure if neighborhood is who I need to talk to or not, but that's who was paying for it before. So, but
We'll
I
get to the
can't,
bottom of it and we'll get back to you. And
I appreciate that.
maybe at the next community event, we can get your permission and just share what the outcome is so people will know how we worked on it.
Sure. Thank you. Yeah.
All right. Yeah.
Sure.
Thank you.
Okay. Thanks.
Anybody else? Those kind of questions are very helpful for everyone who's kind of struggling, particularly through transitions. And we've had a lot of them lately. We've had a lot of growth in the system, but you know, it's always a couple of steps forward, step backward as we work through transition periods. So I'm happy to hear about the kinks. It doesn't always have to be everything's going well. Tell us what you're working on and we're happy to address things. Anybody else? Anyone from the state team who has something that they want to just share? I don't want to force people to speak if you don't have anything to say, but if you do, I just want to make sure I don't close our meeting down before someone had something to say and you just wish you did. If you're sitting on your hands thing, I wish I could just say it. Go ahead and do it. We want to hear from you. That's why we leave time at the end.
I just want to say thank you for the conflict-free case manager guide, because among, our community, I'm not talking about my Ripon hat, but our community, that's one of the things everybody's talking about and asking questions of each other. So I think that's going to be so helpful to all the parents, caregivers, and individuals using self-direction. So thank you for that.
Thanks, Len. I appreciate that.
I had a question about the links. Sorry, there was an awkward pause, so I felt like I had to talk.
Go for it.
The links that you shared, are they going to be in the chat, or do you know if they're going to be like on the website or something?
I'll defer to Deb for that. Where will the links show up, Deb?
So on when you go to the ANA website,
Okay.
there's going to be, you go to the community forums page, there's a whole page just for each forum. and we make little icons that look like the picture of Ripen's guide or whatever. And when you click it, it opens it. So that all you have to do is click and it'll open the link that you want. So
Does that help, Olivia?
Thank
All
you.
right.
mhm.
Yep, thank you. Anybody else?
Kevin, I just can't not because I have nothing. Everything comes right out of my mouth. Amy, are you okay? Amy Collins, I feel so. You just sound so exhausted. Is there anything that we could do to help you? Want me to make you some dinner?
No, I am okay. I ended up taking leave from my job,
Yeah.
and I'm about to extend that, and may not go back. But yeah, no, I am okay. I'm getting connected. I had a lovely conversation with Lynn last week, that made me feel a lot better, and I'm finding the help. And our case manager is wonderful. It's not that it's not really complaints. It's just not coming together as quickly as I had hoped. And it has been a tough spring.
Yeah, we'll work on it.
Thank you. Yeah. Thank you for asking. That was kind of you. Thank you.
Okay. All right, I think we've exhausted questions unless someone says, no, one more. I just want to thank everybody for coming out today. Thanks for the people who spoke up. Thanks for the people who participated by listening. Thanks for the speakers. I really appreciate you bringing the material that helped the community understand the system a little bit better. Advocates in Action, thank you for hosting. We appreciate it. Ripen. All of the speakers, thank you very, very, very much. It's always great to get together, to see everybody in this community forum. It's wonderful. I look forward to the Advocates in Action graduation coming up. So that will be fun. We'll get together in person, right? All right, everyone, take care. Great seeing you. Be well. We'll see you again next quarter.
Good night, everyone.
Thank you.
Thank you.
All right, thank
Bye.
you.
See ya.
Thank you.
you.
Bye. Thanks.
Bye.